The CRAC team have got really good knowledge of all the independent hospitals, as well as all the services that are provided for an individual's pathway. We're able to completely focus on the individuals throughout their pathway, from when they get involved with us until when they move into the community, when we'll get them back in touch with their original team. So it's being able to have that full focus on that individual. It's really useful to be the team and be able to bring things back and discuss it with people who've got lots of areas of knowledge that they've brought to the team, and use that to help people to move forward.
I think for us as a team, it's having an additional spoke to our acute care service really, and their role in identifying those needs for that individual, so that the individual has the right support to meet their needs following that assessment from the CRAC team as part of that acute care service, but also as our acute care practitioners or mental health team practitioners as well. It augments and assists and enhances what we do as a process through somebody's recovery through hospital, which in the end, I guess, means that that individual's needs are met and their outcome is improved.
From the point of view of the service users that the CRAC team review and work with, they're care coordinated by a specialist team who are able to address their needs, working with the local teams and having that more focused input really with those service users. And they're looking all the time at how they can bring those service users back into the local area. And again, I think because it's more focused on those service users, they're able to sort of look more intensely really at those service users' needs, rather than having to manage the needs of maybe 30, 40 service users who have competing needs and requirements.
In my view, the CRAC team are so effective because they are so values driven. They understand person-centredness and are really good at getting alongside people, understanding what really matters to them and what matters to the family and the community that they live in. We were delighted when the CRAC team won the Going the Extra Mile award. They helped 9 patients who had to move quite quickly from the accommodation that they'd been in. Everybody was worried that they'd have to go a long way from home, but the CRAC team worked really effectively to keep them very close.
The CRAC team, through the outcomes that they've demonstrated, have been able to improve safety across the inpatient care pathway. They've used multiple PDSA quality improvement cycles to ensure that they can be the best they can be in supporting our inpatient and community teams across the Trust.